Hi, I'm Dr. David Hill, and today we're going to be talking about infant diarrhea symptoms. Now, this is a little tricky because, especially in newborns, defining diarrhea is very hard. Why is that? Well, newborn babies are going to have tons of stool. Sometimes. Some of them may have no stool at all. So the amount of times a day that a normal newborn infant is going to poop is going to vary widely. It's not at all unusual for a newborn to have a bowel movement every single time he or she feeds. Breastfed infants, maybe even more so than formula-fed infants. Those stools generally are pretty loose and watery. They can have little seedy particles in them. A lot of people describe newborn infant stools as looking kind of like Dijon mustard, which is kind of gross thinking about it, but it's a great description because if you've ever seen a country Dijon with little seeds and the mustardy, it's kind of, just pasty look, that's a normal newborn stool. So some people come to me and say, hey, my baby's a week old and they're having 10 watery, seedy stools a day. Is that okay? The answer is yes, it is. Another thing that doesn't tell us a whole lot is color, as long as it's an earth tone. People say, it's green, it's brown, it's yellow. Is that okay? Yes, it is. If it's red, that's not okay. I don't like to see blood in anybody's stool. That can be a sign of a really serious infection or a serious condition in the intestines that needs to be examined. So if you think you see blood in your infant stool, that's a whole different ballgame. A doctor needs to see that infant, and quickly. So later on, when we're defining diarrhea, we're really looking for a change from the normal stool pattern. If your baby is sort of transitioned, started a little bit of solids, maybe they're pooping 2 or 3 times a day, and now they're pooping 8 times a day, I would call that diarrhea. We can certainly examine that on a more leisurely basis if it's mild, but if you see blood or mucus in the stool, or if your baby is stooling so much you're worried about him or her becoming dehydrated, certainly that's more urgent, and the baby should be seen immediately by a physician. Talking about symptoms of diarrhea in infants, I'm Dr. David Hill.